drugs or substances that get people addicted. So addiction is what? Compulsive behavior. You want to take it. If it's not there, you want to take it. So, and out here we have a small problem. That problem is called Free Drinkers Association. Like you have said, if somebody offers you a free drink, of course, as far as you're used to the drink, you want to, the hesitation to take won't be there. You would rather just take. You know, you go out to some places, somebody gives you a free beer, of course, or there's a gathering and they provide drinks. You're not likely to say no. It takes a lot of willpower, it takes a lot of self-discipline to say, no, I don't want to take. You know, and these are the things we'll talk about. Then sugary drinks. I think there's a lot of ignorance associated with such drinks. If I want to offer you a drink now, it's okay. What do you want? A fruit juice or an alcoholic drink? Or most people will ask for a fruit drink, right? How many people have looked on the package to look at the nutrient content? Sometimes they write 50% energy. That is glucose. Some others will write sugar. But because a lot of people are not aware, things like mayonnaise, ketchup, they all have so much sugar. Just look on the body and see what's written on it. So before they ever write sugar, but now they coin a new word, energy. So most of these drinks contain a lot of refined sugars. Now, if I were to give you 10 oranges and give you an orange drink, which one are you likely to take? If you're not likely to eat more than 1 or 2 oranges, but you can gulp down 2 cans of orange drink. Those orange drinks have a lot of sugar in them. But if you were eating the orange, by the time you finish, you'd have gotten some other nutrients besides sugar. And that is why the body will take time to also digest and benefit from those nutrients. And you're not likely to get so much sugar from eating the orange or apple or grapes or any of these things. So that is why those ones are healthier than these ones that have been, the juice has been extracted and concentrated. Sometimes they even add sugar or other sweeteners to them. And you know, this becomes, because what we try to do is discourage consumption of a lot of refined sugars, because the body is not going to digest it. It just goes straight down and is absorbed into the blood and goes into your body. So
okay, we'll come back to this. We need to go on a commercial break now. All right, we're still talking healthy behaviors as it concerns consumption of alcoholic beverages as well as sugary beverages. Just stay tuned to us. I have Dr. Hamilton Opurum here. He is a chemical pathologist and member Diabetes Association of Nigeria. Just stay tuned. to Hamilton Opurum here with us. So before we went on the break, you were talking about ounces, units, and all of that, and then there was something you talked about orange juice and 10 oranges. You were trying to, analyze the content and all of that. So how about you continue from where we left off?
Well, the important thing to note here is that it's better to take the raw fruits than the refined ones because of the danger of addition of, because of the addition of sugars.
Refined sugars.
And you're likely to take so much more than what you need. And once you take it, it goes straight into the blood and you keep triggering the release of insulin to take care of these things. Something like alcohol, once you take alcohol, about 20% of it is absorbed from the stomach. And of course, it doesn't need too much, it doesn't need any digestion. But if you've not eaten, you're drinking on an empty stomach, so much more is absorbed than when there is food in your stomach. If there's food, it mixes with the food. It takes a longer time to absorb it. So you see, a lot of people who drink a lot, sometimes they go out drinking without food. And so much of it is absorbed straight into the blood. And the rest goes into the intestine where it's also absorbed. And once it gets into the body, it goes to the liver where a lot of transformation takes place. But you see, what we're saying, like you rightly pointed out, is if we cannot treat, because the cost of treatment is up, we want to educate people and create a lot of more awareness so that people can make informed choices, make decisions that is going to be positive for themselves. That is, can you reduce the consumption of these things, knowing that it has certain negative impacts on your body? So that is exactly what we should pay our attention to, because every day people are carrying out research, and they find out that sometimes we raise certain, okay, if you drink every other day, it's okay. Some people say, if you take red wine, it is more beneficial.
Yeah, it's good for the heart.
And because they look at the French people, they drink a lot of wine, especially when they are eating. And most of them don't have heart problems compared with Americans and all that kind of a thing. So there are certain peculiarities, and you need to understand these things deeply. Some people have even said that even the white wine is more beneficial than the red wine. But you see, where we are, those things are foreign to us. Our own drinks are not the same, and some people say, okay, we'll prefer the palm wine. Palm wine also has certain nutrients in it if it's not adulterated. A lot of people buy wine, and what they're consuming is a lot of saccharin that has been poured into it to make it sweet. So because you're not really sure of what is presented to you, the safest drink to drink is water. So how do you make choices? We list out a lot of content, a lot of issues about these things, but the decision is always yours, who is the individual. And you make choices by looking at the positive and negative effects on you, your pocket, your body, and your family. So the decision at the end of the day will be yours if you consider the net effect this is going to have on you. And then you can go, because nobody can come out and say, because people would defend themselves. My great-grandfather drank a lot and he never had any problems. My father drinks every day, he didn't have a problem. But you also have your own body composition. What you're exposed to and what the other person is exposed to may be different. Your body, your response to certain challenges will obviously be different from what some other person will experience, and how your body handles these beverages obviously are different, so you cannot tell. So when we look at how the body, we can discuss the biochemistry and health effects But the most important thing is, how does it impact on you as a human being? What will you want to do? Want to keep drinking? And then you have a lot of issues. So basically, when we drink alcohol, what happens? As it goes into the blood, more than 90% of the alcohol goes to the liver. It's the liver that has an enzyme called alcohol dehydrogenase that tries to reduce the impact of the alcohol by the alcohol dehydrogenase will convert this alcohol to what we call acetaldehyde. Acetaldehyde is a very toxic compound. It's toxic and also carcinogenic. That means it can also cause cancers. And this is produced, but it further reduces the acetaldehyde to acetic acid, and which is further broken down to carbon dioxide and water. As acetic acid, you can now use it to generate energy. So once you drink alcohol, the body will leave the food there and break down the alcohol faster. So what you find is that the fatty acids in the liver, rather than being broken down, will just be stored there, and the body will keep breaking down the alcohol. And that's why people who drink a lot have what we call fatty liver disease. Then because of the acetaldehyde and all that, they could also develop cancers. And by breaking it down this way, the body now allows the alcohol to be spread all over the body. So the heart will pump the alcohol-laden blood to the lungs. And that is why, overseas, when the police stop you, if you've taken a lot of alcohol, how do they test? They ask you to do a breath test, because it's released in your lungs as well. So when you they give you something to blow into, they'll be able to detect how much alcohol is in your blood. And the lungs will still push it back to the liver where it circulates. It goes to the heart, it goes to the brain, goes to every other organ of the body. And the continued amount of alcohol in your body creates a lot of problems, which people may not be aware.
Please, if you could help us highlight these problems.
Yes, let's say when you drink alcohol, one of the first things you notice is that you pass a lot of urine. It means that it has compromised the way your body manages water. So it decreases what we call the antidiuretic hormone. Antidiuretic hormone is what helps the body regulate the amount of water. If there's too much, it will reduce it so that you can pass more urine. If the water level is going down, it will stop it and then drive you to take more water. So, but when you take alcohol, it decreases the antidiuretic hormone. So what you do is you keep passing urine until you begin to get dehydrated. Because rather than water, you're still taking alcohol, which contains some solids. So your body is losing more water, and people get dehydrated. And when they take so much, you see some people go into coma because they have lost so much fluid from the consumption, and the concentration of alcohol in their body is so much, they could go into coma and could have respiratory depression and eventually death. So, like I said, the acetaldehyde, which is obtained when the liver enzymes try to break down the alcohol, could be responsible. Like when people drink a lot, the next day they have hangover. Most times they have a headache. It could be due to the acetaldehyde. Then increased urination, of course, dehydration, and their mouth to be dry. They feel very thirsty. It could also lead to the release of some chemicals we call cytokines, and this will cause people to feel nauseous and throw up and be fatigued. Then there's increased secretion of gastric acid. in the stomach, and consequently, these things could lead to ulcers, in the stomach, because you begin to have the acid content is going to be so high, And you see, after drinking, or the next day when people are having a hangover, some of them complain of stomach pain because the acid content in the gastric juice has gone up so high, Alcohol could also interfere with how the liver manages glucose. Because when you've not eaten for a long time, the liver goes through a process we call gluconeogenesis. It uses other nutrients to produce glucose that gives you the energy the body needs to run. And when you're taking alcohol, it blocks all of this process. So long-term effect of that, you lose energy, you feel very tired and dizzy. You have so many of these feelings that people have. It also affects the brain, because it also causes anemia. Anemia is low blood level. The red cells that are required to carry oxygen are deprived of certain nutrients, and they're not there. So this could cause cell death in the liver and the brain. A lot of organs will begin to malfunction. Heart failure will be on the increase as well. So there are so many things that alcohol consumption can lead to. You see, here we overlook a lot of things associated with alcohol. A lot of people get so dependent that they require psychiatric help. But most times they say, they drink alcohol, can't stop. The willpower is no longer there because it's highly addictive. And because we overlook them, we do not realize that they need that kind of help. Because some people drink so much and they keep bottles and drink. So when these consequences begin to happen, when these things begin to happen, people may not really appreciate what they are going through. And our healthcare system, being the way it is, most people pay from their pocket. So it's difficult to really focus on these things and do very much to help them. So a lot of people die.
I was going to ask this, and those people that we label drunkards around, I don't know if it's every village that has it, but there's that one person people refer to as a village drunkard, and that nobody should take whatever the person says seriously. Is it how would I put it? Is it now a psychological thing? Is it the alcohol they had taken years before that time that has put them like that? Or is it because they are constantly drinking?
Well, I think most of them are addicted. So they are addicted. Sometimes they may be sober and people will not notice. But if you look at them very well, you'll find out that they have a joint where they go to. And most of them in the villages are addicted to kai kai, which is the local gin. It's cheaper. And most of those who sell, once you come regularly, you become a customer. So even if you don't have the money,
they give you.
Some people will come and say, the free drinkers syndrome. Some will say, I don't have money to take now. It's a small thing you just take. So they encourage each other. I say because once you begin to take alcohol, it makes you a bit freer. You're free to talk with anybody. You fraternize with a lot of persons who ordinarily you would not want to say a lot of things. But the moment you've taken, you have that general feeling that everything these are good friends and everything is there. You're just talking about so many things. If you look at it security-wise too, the agents get some people drunk so that they can say a lot of things, either reveal office secrets or family secrets, and those are, what they like to know, those are some, issues with drinking. But for those who are labeled as drunkards, if you look at them, they are addicted. And if they can't afford the very expensive ones, like we said earlier on, they go for the cheaper one because it's more quantity and it's readily available, and they keep taking.
Okay. Now, back to why we are even having this conversation in the first place. You did mention when I was discussing this with you yesterday that everyone has a limit. Okay? And sometimes it may be somewhat difficult to spell out an exact quantity. Because for Mr. A, the person can afford to take 20 bottles. No shaking. In fact, they give you champion Drinkers Association of Nigeria. In fact, let me not even go far. If you are from the Riverine area, you know, they say that we used to use this thing to wash our eye when we wake up in the morning.
To wash about.
You know, be anything. You know, the women drink, the guys drink as well. And sadly, I have been in places where parents or mothers or fathers would even put some in the mouth of infants and little children, okay? So that is, if you have seen someone who drinks a lot and yet doesn't act like anything is the problem. And then there's some people that we come and they drink, and one sip, they have loose guard. That's the best way I can put it. So what would we use as a caution sign? Yes, telling someone not to drink at all may seem almost impossible. Is it your money? Is it your alcohol? But what are the things they should look out for to know that at this juncture, I should stop, or I should minimize, or whatever it is?
Well, like I said, I try to explain how the body handles alcohol. You see that if you drink a lot, your body will develop more alcohol dehydrogenase. That's the enzyme in the liver that breaks down the alcohol to form the acetaldehyde and all the others, and it spreads it out. So you see, those who drink regularly, probably every day or thereabouts, or every other day, on good quantities, some take like 2-3 bottles a day, you see that their capacity to withstand the effect of the alcohol, or the how do I say, the shaking level.
That one that they say, you are tipsy or you are high.
Yes, they may take more before they feel tipsy. For some other person who doesn't drink, maybe you take once in 6 months or once in a month, and your level is very low. You just take one bottle and you're already feeling, But you see, like I tried to explain, it's not just feeling tipsy. When the body breaks, the alcohol dehydrogenase breaks down this alcohol, I have the acetaldehyde. I said it's both toxic and carcinogenic. Now, depending on certain other predisposing conditions in your body, it may trigger some organ damage or any other thing, and some people go on to develop cancers. They say, but how much does this person drink now that he's having cancer? This other person drinks every day, he's not having this problem. So you cannot tell what is each person's condition before you start prescribing. The issue is that they have looked at people's, okay, if you drink once in a month or thereabout, that you can't count that as drinking. And most likely, when they examine people who drink sparingly, I don't want to say occasionally, because some people say the occasions happen very often, so you can't say occasionally. So this kind of situation that when people take for maybe once in a long while, that they are not likely to report certain health conditions than those who take very regularly. But again, we know that so many other factors now come into play. The economic challenges now are such that some people are not eating very well, and when you add these other challenges to it, you cannot predict what will come out of it, So it's difficult for anyone to prescribe that just take a drink a month or drink a week or thereabout, or drink every other day, that you'll be safe, you'll be okay. It doesn't work that way. And besides, the way drinks are made these days, we have so many brands, being pushed out there. These are chemical substances that have just been mixed up to great sense. And such chemicals, everything that goes into your body, first of all, is goes to the liver. Once it's absorbed into the blood, it goes to the liver. It's the liver that has that challenge of trying to break it down and make skid legs toxic so that it can either pass it out in urine or stool and all that. A lot of times the liver is overwhelmed. So the liver may begin to have cancers, or have cirrhosis and all kinds of things. So I'll hesitate to prescribe anything to anybody. But the thing is that if you have the willpower to resist drinking, good and fine for you.
Good and fine for you.
So you do not say that because this person is drinking, I can also drink. This person is taking 1 carton, let me take 1. And then if there are free drinks,
bring it.
Here in America, nobody buys you a drink. You might say, let's go out to the pub.
You're paying.
I pay for my drink, you pay for your own. So if people are paying for their drink, you look at your pocket first. Can I afford this drink? If I'm going to spend 500 or 1,000 to buy a bottle of drink, it could have fetched something else that would be useful to my family. And so people make these choices.
Okay, I would not like us to lay emphasis on alcohol alone because, of course, there are sugary beverages. But I don't think we have, extended the conversation on alcoholic consumption as we have today. I mean, last year when I had you, we talked about the sugary. Yeah. So how many minutes do we have? Okay, let's say we have about 10 minutes. And I would like to open the phone lines and take some calls. But before we leave, you just say a thing or two about how to check for your sugar consumption and all that. 0817-923-0002 and 0817-923-0003. Again, 0817-923-0002 and 0817-923-0003. A question here says, it's from Anonymous. Can you talk about low sugar hypoglycemia? Doctor advised to take Coke, and once taken, migraine headache reduces or stop. Please say something about it, doctor.
Yes, hypoglycemia is a very delicate situation. And it occurs more often in persons who are diabetic, who are on diabetic drugs, or insulin. And it happens if they take these drugs and do not eat at the time they are supposed to eat. So their blood sugar may go very low. And why we worry about it is that when it gets too low, the person can actually, because the brain is also starved of energy, so the person could go into a coma and eventually die from there. So, but you begin to feel the early signs, feeling very uncomfortable and shaking and all that. So if you know that you're in that kind of a condition, or somebody who is close by is aware of